I'm Dr. Kwame Williams, and I'm a physician. I'm trained in podiatry medicine and surgery, but a large part of my practice deals with sports-related injuries. A lot of these things happen from a lack of stretching, improper support, or overuse. So these conditions and treatments will be discussed today. In sports medicine, injury prevention is key. The first one would be proper shoe gear and shoe gear selection. A lot of it comes down to knowing the anatomy of a shoe. A shoe should be wider than your foot for one. I like a shoe that is stiff and stable because the best foot are stable feet, so a stable shoe makes sense to me. I think that a shoe with a straight last is best, is what we call it. Think of last as a way to see whether a shoe is a right or a left foot. A shoe that has a straight last, you have a hard time distinguishing between the two, and that gives your foot a better, wider stance. And I think if you observe all those three things when selecting a shoe, you're going to have the best shoe that's going to prevent a sports-related injury. The muscle that's most important that you have to warm up actually is your heart. If you increase your heart rate, you kind of prime your body to be ready for the next phase of your workout. Prior to engaging in the rest of your workout also is flexibility. Flexibility of the whole body prevents injury. If I had to pick the most important part of your body, it's the posterior part of your body, the back of you, neck, back, gluteus, butt, hamstring, calf, Achilles tendon, all that conspires to make all the structures on the bottom of your foot. If the back of you is flexible, the bottom of your foot is better for it, prevents sports-related injuries. Particularly in a foot, there are 27 bones in a foot. The best foot has no motion. It's very structurally sound. The feet we treat are very unstable. They need structural support. Oftentimes we pair a bad foot with a custom orthotic to provide some of that inherent stability to an already injury-prone foot. We put this combination into a stable shoe, and it allows for a nice structural, stable, sound construct to move forward while you're trying to treat your sports-related injuries. A big problem is inflammation and the control of inflammation. That's where anti-inflammatory comes from. Every injury begins and ends with inflammation. A big way to control and treat inflammation in the lower extremity, the best way, is a compression stocking. A gradient pressure device, stocking, sock, from your toe to your knee can actually force and move the inflammation back up to your heart to reduce that inflammation. Is the best anti-inflammatory in the world. If you want to prevent injury, start with a compression stocking. Understanding these four categories, employing the simple strategies within those four categories can prevent sports-related injury, results in a stronger, more effective athlete. If you have any questions with what we went over today, give one of our physicians a call at our 20 locations and we can go over these questions with you.